Hi, my name is Dr. Kerry Tapuzian, and you're watching the Ask Dr. T show. Today's question is, why am I losing my hair? And in the past, we've talked about this before. We've talked about how it's important to make sure you're absorbing your nutrients. And if you're taking any antacids or any of the medications for GERD, that you're not going to absorb certain nutrients and you can lose hair from that. It can actually throw your thyroid hormone off. And speaking of thyroid, you always need to make sure that your hormones, thyroid, are in good functioning order, that you're taking a good nutrient for your hair. A really good one is called Nutrafol, which I'm sure you've seen advertised on TV. But today we're going to talk about going the next steps if these things aren't working for you. And basically, I got COVID. I got COVID 3 times, and every time I got it, I started losing hair. And after a while, it was starting to be kind of irritating because couldn't do anything about it. Just kept falling out, falling out. And so then what I decided to do, and this was back in February of this year, 2023, I kind of got some information that a patient sent me, and I also did some research. And I started doing 3 things. The first thing I did was I started taking low dose minoxidil. And I'm not talking about topical, I'm not talking about Rogaine, but I'm talking about actually a prescription tablet, very low dose. Now, minoxidil originally came out on the market for high blood pressure, for hypertension. And the dose for high blood pressure is 5 to 40 milligrams a day. Well, there's some studies that show that microdosing or low dosing of minoxidil will help with hair loss. And so the dosing for men would be anywhere from 1.25 to 2.5 milligrams a day. And for women, it would be even a little bit lower, possibly. So I started this, and I also started taking a topical serum that I would put on my scalp, and it had 4 components in it. It had minoxidil, it had finasteride, which helps with conversion of DHT, dihydrotestosterone, so that your hair doesn't fall out. It also had a mild steroid in it, and tretinoin, which is a type of vitamin A. Once a day, at night, before I went to bed, put that on. And then I started using red light. I started using a red light therapy on my scalp. And there's plenty of them out there, but the one that I was using was called a laser cap. Okay. I mean, I started noticing something in a couple months, and I mean, okay, take a look. The thing is, I didn't do a before and after because I usually don't like those before and afters. The before pictures, like black and white, the person's like, frowning, no tan, and the lighting is horrible. They got some drab color shirt on. And then the after picture is they've got a tan, they're smiling, everything's bright and happy. So I just didn't do it. But in retrospect, I probably should have, because, I could see my scalp, from when light would shine on it just the right way. So didn't like that idea. So these 3 things worked really well. And there's not really a lot of contraindications or reasons why you can't take minoxidil as a pill. Granted, it is for low blood pressure. And if you have a history of low blood pressure, it could affect you. And again, some people can have some side effect from medication. But again, so far we've been pretty good. Haven't had too many issues, if you will. I'm not going to say zero, but if you do have a problem taking it, then you stop taking it, just like any other treatment or medication you might be on. Again, it's a very low dose. The product that has the serum with the four medications in it is called Phytosol, Phytosol. And no, you're not SOL if you use it. That was a bad joke. So the other thing that, I'll get patients ask me a lot of times is, well, do I have to do this forever? And the answer is yes, you probably will have to do it forever. And sometimes I'll say, well, do you brush your teeth? And it's like, well, yeah, of course I brush my teeth. Well, why do you brush your teeth? Well, because I want to keep my teeth. I don't want to lose them. It says, well, you kind of have to think the same way about your hair. Is it something that is worth it to you that you would do for daily for the rest of your life? Okay. Um, Minoxidil as a prescription is extremely inexpensive, you know, maybe $5 to $10 for a month supply. The phytosol, the serum that you would use on your scalp, is runs about $125 for a 2 month supply. And the laser cap that we particularly use, it's the laser cap HD, is, I believe it's $1,500 for that. So if you're a patient, uh, then you can make an appointment, to a short appointment, to talk about this and to get the prescriptions. If you're not a patient and you're interested in this, as long as you live in the state of Colorado, Michigan, or the great state of Texas, I have licenses in those states, so you can call our office to make an appointment. You can either get a hold of us at DRT helpdesk at gmail.com, or you can call the office at 248-240-0450. Any other questions out there? Doesn't look like there are. Guess I did a good job this time. Well, if you do, you can always email or call. You've been watching the Ask Dr. T show. Take it easy.